Hi everyone, thank you very much for joining us for this digital event promoted by MDConcierge and Kaleyra. We are really glad to see many people joining us for this interesting topic. It means that it brings valuable content to the audience and to our community. Sorry for the slightly delay. We just were waiting that many people were joining us. So I'm really glad that we had the opportunity as MDConcierge and Kaleyra to organize this event on the telehealth and connecting care, because we think that is a topic that has let's say a dual side. From one side, everyone talks about telehealth and telemedicine, but it's really difficult to understand the potential and the value of this technology if you don't bring it properly with the right approach. I'm Andrea Carlo, product marketing manager from MDConcierge, and just before moving to the panelists, I would like to highlight a little bit more the current state of telehealth in Europe and how telehealth can actually improve the quality of life for everyone, for citizens, for patients, and for assistant people. We decided together with Kaleyra to bring this topic to our digital audience because it's a few years that we are working together on creating the best digital environment, the best digital place on which building digital services for healthcare and improving, of course, the relationship between doctor, patients, care services, care facilities, and the community as well. The webinar will be organized will be in 3 phases. We have 3 panelists. We have Marzio Ghezzi, CEO of MDConcierge. Hi Marzio, how are you doing?
Thank you, Andrea. Good morning, everyone. So glad to be here.
Great. Marzio, we will talk about composable architecture, platform engineering to build modular digital healthcare platform. And after that, we will have to the stage Mary Wieder, product marketing manager from Kaleyra. Hi, Mary. How are you?
Hi. Thank you for including me today.
Glad to have you here. She will talk about the toolbox that Kaleyra provide in order to improve communication between doctor and patients, and mostly to let's say create an omnichannel experience for every patient and every citizen. Last but not least, we are really glad to introduce to our audience Riccardo Altura. Hi Riccardo.
Hi Andrea. Hi, thanks everyone. Thanks for having me here, and good morning to everyone.
Grazie Riccardo. Riccardo is the CIO of one of the fastest growing digital health startup in Italy, and he will talk about MDConcierge business model and how MDConcierge strives every day to bring the highest quality of service of healthcare services to their assisted people and to patients that use and leverage those services. Just before leaving the stage to Marzio, I would like to give you a glimpse of the current status of telehealth and telemedicine diffusion around Europe. As everyone may know, basically telehealth and telemedicine become very trendy during the pandemic. Many investments were done on building new telehealth services and focusing on telemedicine platforms, basically with 2 main aims. The first aim is to, let's say, democratizing the access to healthcare to different people or through different channels and in different ways. The second, of course, is improving the real quality of service provided, because through video streaming services and digital services, of course, citizens and patients can access to those to those services quicker, simpler, and even in a more, let's say, with a better, basically, user experience that, of course, improve the overall quality of the services. Starting from that, we would like to highlight the current situation institutionally. We understood that countries from the COVID pandemic invested a lot on improving their computing infrastructure related to healthcare services, related to improving the quality of care structures providing care services. From this slide, basically, we can see that most 60% of those companies improved their computing infrastructure in order to, let's say, give to patients and to private companies the toolbox to, let's say, provide digital services at the best way. At the same time, they focused, of course, even on telehealth services by creating the technology framework to make those services valuable for all the clients. But of course, the main burden here and the main limitation were coming from privacy and security issues. So it means that before providing healthcare services around the different territories of the countries, institution have to be sure that those services are compliant regarding to data regulation, data security, and data privacy. Right now, we can say that institutions and countries are going in a right direction, since more than 80% of countries in Europe are actually creating country-based regulations for dealing with privacy and confidentiality issues, as well as most of the countries, more than 70% of the answer highlight the fact that they were focusing mostly on security, data security, and data governance. Overall, this means that private companies and public institutions have to rely a lot on technology to provide best-of-breed digital healthcare services, but at the same time, they have to rely on technologies that are compliant by design, ready to be, let's say, ready to interact with the current GDPR and MDR regulations in order to protect and guarantee the privacy on citizens at the best level. As Miaker and Kaleyra, we deeply believe in the framework and this kind of proposition. And today we would like to give you a sort of toolbox to better understand how technology can efficiently interact with data privacy and security regulation by using cutting-edge digital technologies provided by Miaker and Kaleyra as well. Starting from that, I would like to leave the stage to Marzio, that will present you the composable approach on building a modular digital health platform.
Okay, thank you, Andrea, for the introduction, and good afternoon, everyone. So before going into the topic, I would like just to introduce Mia. So what we do every day, right? So few of you probably already know the company. So we are essentially an independent software vendor. We've been founded and our headquarters is in Milano. We experience tremendous growth since we established ourselves. Thank you to our flagship product that is Mia Platform. Since 2016, we grew year over year, so with a tremendous growth rate. You see here some numbers. So today we are almost 200 employees. Majority are based still in Milano, but we are expanding and scaling up in Europe first. We have already 2 offices, one in London, and the second one we just kick off our presence in Amsterdam, and next would be US. The company per se serves large markets. Major targets are corporates, but we work as well with the startups. And the aim, of course, is to feature these companies with a tool that will enable digital transformation, right? So, and make sure company they are equipped with the right set of tool to leverage the best of breed in terms of cloud capabilities. Since 2021, we got, I would say, a special focus around healthcare, and particularly we decided to found MiaCare, and today I'm here to represent, of course, this initiative. Last but not least, so our international presence, right? So got attention also by company like Gartner, right? So that are best in class consulting company around new technologies, right? So that are emerging today in the market, and we got the nomination of Cool Vendor in 2021. Going a little bit more into the topic today. So if you think through what are the major challenges around the digital transformation, and particularly what people, a company are facing as challenges, right? So you see that speed is one of these elements that today everybody is looking to grant and to execute, right? So the ability to build and launch new digital products with greater speed, right? So it's one of these elements that is a challenge and a key for success. Evolvability or the capability, right? So to move according with the business and not become, I would say, in terms of digital assets, right? So the bottleneck, right? So it's another factor to be considered. Scalability, right? So if you think, right, so company that they want to scale initiative from MVP to commercial product, scale it also in terms of new business opportunity or new markets, right? So it's a factor of success. And also healthcare is becoming more like an ecosystem, right? So there is a need to integrate more existing legacy systems in hospitals or databases that relies, right? So with the companies that maintain EHR, for example, right? So this level of integration is essential today to explore the value of the data, right? So all these elements are essentially transforming the way the business works, right? So around digital, especially for, again, the digital transformation in healthcare business, right? So, and we see, right, so this shift of being a consumer of technology to become a developer of technology, right? So I just read an article, right? So from another consulting company, and so the title of that article was by 2025, right? So a lot of digital, a lot of companies, right? So that are working in the healthcare business will become tech company, right? So that is where the market is moving today. Of course, right? So there are constraints to be considered, right? So being, I would say, cost competitive, right? So company, they want to be fast, they want to be capable to evolve with the business, they want to be effective, meaning getting the right product in the end of the right customer, they want to be open, right? So, but of course, right? So we work on the business, we essentially need to be cost competitive and time effective, right? So, and today the way to embrace this digital transformation, become tech company, and in a sustainable, in a business sustainable manner, right? So requires a totally different paradigm, right? So in the way you approach digital, so the way we see, right? So the market and the business going is to become, I would say, a company where the composability, right, so is the key of success, right? So a lot of company, they used to, I would say, go more greenfield and build things, right? So as the needs surge in the market, right? So, or company were relying on SaaS solution, right? So out of the box, ready to be configured, deploy, and use in the market. Today, this is not enough, right? So you need to really think through the transformation also in terms of the way you attack your business. And for us, right, so composability, it's a winning factor. It's not just for us, right? So we pick some, I would say, of this report from Gartner, and we see that so there are emerging topics, right? So like application composition platform, right? So or platform engineering, for example. What those things means, right? So that essentially, so company are looking to compose like Lego, right? So solutions, right? So starting for building blocks, they rely more on the capability, right? So to access to those building blocks and leverage tools in order to compose, customize, and deliver the end solution to the market, right? So, and this is platform engineering. And cloud native, of course, today we all know, right? So the cloud is this element that will allow company to scale, to become more internationalized, and to leverage the integrability, right, so of data through, I would say, a common place where this data can be shared, or you can interconnect your solution with other providers that leverage as well cloud as a means to transfer data end to end. So I think that is essentially what we see coming. And right, so Gartner, right, so another company, they are looking, right, so to those trends and survey as well the market. And essentially there is a confirmation that by 2025, right, so IT investments in building composable application will double, right? So the market is moving from this monolithic approach to leverage really the capabilities of solutions like Mia, to take components, right, so made by Mia, made by vendor like Kaleyra, made by the company, and build the solution or use the solution for the next market need, right? So in that way, there is for sure a saving, right? So or a better way to get, right? So one solution to the next one. Okay? So, and this is becoming as well a strategic objective, not only for the IT department, but for the entire organization. Organization need to rethink also the way they work together, they collaborate. So they need instruments, right? So in order to enable this ability to share components and create a solution through those components. As Mia, right, so we fully embrace this vision. Actually, we were the first, right, so to come with this idea in the market. And actually, we offer to our customers and the market, right, so components that will enable this composable platform approach for corporates, right? So you see essentially in a very simple manner the way our product works, right? So on the left side you have our internal development platform that is a tool given, right, so to the IT fabric of a company or the software engineering organization in order to be more self-service in the way the software development life cycle is managed on the cloud, right? So you find a lot of features that will essentially provide in a convenient manner all the different applications, right? So that typically I use in order to design, build, deliver, test, deliver, and manage, maintain your code on the cloud. On the right side, you find our software catalog, right? So really that become the place where this idea of the Lego composition, right? So it's fully established, right? So it's a it's a marketplace essentially where we deliver, or our partner deliver, or customer could deliver, right? So their digital assets and share it, right? So within the company, between different teams that they will need essentially same components for different application, or it's a means to distribute IPs, right? So between different companies, right? So like Kaleyra does, as an example, with the MIA platform marketplace, right? So I think that is another great tool to have as a part of solutions, right? So to design, build, compose, and deliver digital application. And the platform is capable to address the three major layers of a digital platform. Right? So from the capability to connect existing systems. So it's your CRM, is your e-commerce, is your ERP. It's, I would say, the means that you use in order to orchestrate your supply chain, right? So, and harvest the data and provide this data to your business logic, right? So the way we typically work in order to be fully compliant with this idea of composability, it's to create a microservice based architecture and then expose, right? So these services to digital channels, right? So in order to create application or harvest real-time data from different digital touch point and feed, I would say, your legacy system with real-time data without having, I would say, cost constraints or performance issues, right, so around those systems. One of, I would say, the major effort, right, so we do, right, so it's to make sure, right, so we fit every day this catalog with best in class components, right, so that for our customer becomes digital assets they can use in order to address specific use cases they have when they think to build their end solution, right? So as I said, not everyone wants to go greenfield. Actually, our platform will allow also this direction, but if you think, right, so what is essential, important, and valuable for a company, our recommendation is to get focused, right, so on those elements. Customer experience is one for sure. Other elements are those, I would say, services that in the end are key assets for the customer, and leave, right, so the rest in a more buy, right, so procurement way. And our catalog, right, so that today is populated with more than 100 different components, allow, right, so to pick, configure, and deploy easily, right, so in the cloud, many different services, right? So, and today we are here to present essentially services around customer communication and customer engagement through Kaleyra. In that way, right, so you can really create in a very convenient way. Convenient means, right, so cost competitive, time effective, right, so with best in class cloud capability solution, also complex platforms, right? So, and the idea again is to connect this Lego, and the platform is designed in order to really get this connection in a low code, no code manner, right? And deploy this, right, so on your application, on a web portal, or in any kind of CMS that may be already something available to the market, right? So the platform is totally agnostic, not only to the cloud provider, but also to the end solution in terms of ability to access, right? So in terms of users to the end solution. Okay, with that, I think I was in time.
Grazie, Marzio. Thank you very much for your testimonial. It was great to better understand the technology strategy behind MiaCare. Now we will leave the stage to Mary. Mary, the stage is yours.
Great. Thank you very much. Thank you again for everyone that's joining us today. I'm happy to be here on behalf of Kaleyra. And thank you again to our partner, MiaCare, for inviting me to be here today. I think our collaboration with MiaCare is an excellent example of how we've been able to integrate our omnichannel solutions into use cases specific to healthcare. So I'm happy to talk to you a little bit about that today. So my name is Mary Wieder. I'm a senior marketing manager in Kaleyra. So I manage several products in our CPaaS portfolio, including our real-time communication channel, which is Kaleyra Video, which I'll talk to you about in a minute as well. So just to give you, a quick background on myself as well. This webinar is also, of particular interest to me as well, since I spent over 10 years in the healthcare and pharmaceutical sector in my career as well, covering different spectrums, working, from CROs, pharmaceutical companies, pharmaceutical technology, clinical trials, and also a little bit in the pharmacovigilance space. So I've seen how the digital transformation has hit these companies, especially in the last 5 to 10 years, where even companies were starting to think about, should we be having a specific team, a specific department for digital transformation? Now it's how do we select the right tools, the right business model to move that digital ecosystem forward. Just before we get into the actual omnichannel solutions, for those of you that don't know Kaleyra, so we are a global leader and major player in what is known as the CPaaS market. So CPaaS is communication platform as a service, which you also saw in the diagram that Marzio showed us earlier as well. So we're a global provider of mobile communication services and omnichannel solutions, mainly to enterprise companies and organizations around the world. So what do we include in that portfolio, which I'll talk about more in a minute, is several messaging services and also some real-time communication platforms as well. I think what's important to know here when we look at our model as well is that it's not just providing a channel. So it's providing an end-to-end solution that's specific to the use case that not only our customers are looking for, but I think the real difference in our solution, our business model, is that we think of the end game, which is the end user. So whether that be a consumer, whether that be a patient, we look at helping companies and organizations really define that omni-channel journey for the benefit of their end user. So it's not just providing the channels, it's what is going to be your outcome. So just to give you a little bit on who is Kaleyra, over 25 years in business as a multinational company. We have offices located globally, Europe, the APAC region, the US, but we're a global workforce of over 600 employees as well. We're enterprise focused, as I said, but we're scalable and flexible. What we really count on in our products and our offering is high quality, security, and reliability for our clients as well. That comes with our deliverability rates, the security protocols that we have on our products as well. We're highly specialized in transactional communications, and we're highly experienced in highly regulated sectors. A big portion of our client portfolio are in these highly regulated sectors like BFSI and, of course, healthcare. We know that there are a lot of regulations in place when it comes to especially digital ecosystems today. What is Kaleyra in numbers as well? We sent over 51 billion messages last year. We had over 8 billion voice calls, and we have a portfolio of over 3,800 clients as well. So I wanted to talk to you about what our healthcare communication toolbox looks like. So what exactly do we provide for our clients? So I think what's important to know is that we have a proprietary platform called Kaleyra.io, and we offer a full suite of communication tools. So we start with who is our customer. So whether that be, in this case, a healthcare provider, and that could be an actual institution itself, or it could be the physician that needs to connect. And then we have our portal, and we also have our own robust APIs, and they're provided either through an internet protocol, so in the cloud via internet, or a mobile carrier. And then we have our platform of services that reach the end user. So we have several messaging platforms, including SMS, MMS, We also have WhatsApp, which is our fastest growing channel as well. I think we know the power of WhatsApp today. It's a platform. It's technically classified as a social media platform, but it has over 2 billion global users on the platform. We know that it's very popular in Europe. It's fast growing also in the US as well. We recently launched our WhatsApp business platform in the United States as well. And we have that as both user initiated in terms of customer service or customer support, but also company initiated for things like notifications. We also have classic channels like email, which is kind of the most trustworthy channel today for a lot of companies and organizations. Push notifications, chatbots. We have voice calls operated by mobile carriers, and of course our real-time communication platform, which is video. We also take pride in the fact that like I said, all of our products are, we adhere to the highest standards of security and privacy for our products as well. They're GDPR compliant, they're CCPA compliant for the state of California as well. And they're, of course, ISO 27001 certified for information security management as well. And we do have regular audits to ensure their compliance as well. So before we move on to the specifics of healthcare, what I did want to share about Kaleyra is, as of the 5th of October, we have joined the Tata Communications family as well. So this acquisition was announced back in June. It was finalized on October 5th. And this just basically means that we now are going to be able to empower global enterprises to offer full omnichannel and personalized experience through a customer interaction suite. So we're reinforcing the strength of our channels and our channel offering. We're taking the power of the Tata Communications DIGO platform and our Kaleyra platform.io, and we're making an enhanced platform to make vertical specific solutions and really have enhanced channel offerings for our consumer base. And you might know Tata Communications from their Formula One sponsorship, but I wanted to kind of reinforce that our future looks stronger in terms of our product offering. So to go specifically to healthcare, and Marzio touched on some of this as well, I wanted to look at it more from the communication side of things and that digital ecosystem. So what are some of the main challenges that companies face? I think in that whole healthcare ecosystem, we look at time and accessibility. Time is always of the essence, and accessibility, making it accessible to the patient, which we put at the center of our entire omnichannel journey. I think when we look at the entire healthcare system, and as I said, someone that has come from clinical trials and CROs, we look at getting therapies or drugs to market today. I think the average time is somewhere around 10 years and costs over $1 billion to bring a drug to market. When I was looking, when I was working also in clinical trials, 80% of clinical trials fail to start on time because of patient enrollment issues or communication and recruitment issues. So we're not just looking at, in that case, we're looking at patients as well. Physicians today need quicker information on therapies that they can prescribe to patients. So we're looking at really that whole communication ecosystem and breakdown. Just to give a very clear example, when I worked in healthcare, I worked with some large pharmaceutical companies also based in Italy. One was the largest producer of cystic fibrosis drugs, and they were looking to create a communication system that went beyond the therapy, as they like to call it. So going beyond just the actual treatment of this disease, they looked at how can they be communicating more with actual patients. And they were looking at the different communication channels, also because there are only so many cystic fibrosis research centers and treatment centers in Italy, for example. So if someone doesn't live within that range, it can be difficult for them to get regular treatment or be able to talk to doctors or be able to even get in touch with the community of other patients that have the same disease. So the idea was to create more of a digital ecosystem relying on communication channels. Of course, when we think about the other challenges, we need to think about what are these cross-channel communication. We know today that data has become the currency of the healthcare sector. So how do we, and that makes it more susceptible to data breaches. So how do we manage data in a secure way? And of course, managing resources across the whole value chain. So that includes personnel, overhead, software systems. How can we make this whole process more efficient? I want to look at telehealth also from the communication side. So just to give you a look at the market from that side, 85% of hospitals are shifting towards an investment in digital platforms rather than construction. So they're looking as people become more comfortable in this type of environment. If we look at specifically at Europe, so Europe's aging population is expected to exceed 150 million by 2050. And we know that this is a primary target for therapies and care. So if we can move that to a telehealth approach as well, we're going to see more opportunities in this area. Reports estimate that home healthcare costs can potentially save companies and organizations up to 30%. But we also know, as I said, that the healthcare industry is susceptible to data breaches. So the healthcare industry alone records the highest cost per data breach, and this is the global average. And the most common data breaches are hacking and IT, and there were over 700 incidents alone in the US. So how do we provide a complete omnichannel solution that's also secure? We have to look at a new model in healthcare. So we have to look at this omni-channel communication model. We need to put, obviously, the patient at the center of all our communication. So we have to look at, for example, what are all the channels that they have today? And we talk about touch points. These are all the different ways that they have to be in touch. So we look at things, a lot of channels that I mentioned before, the social media, the email, all of these different channels. And we look at how we need to get in touch with them. So we have healthcare providers, so we have institutions that need to deal with things like patient records. They need to be concerned about data and privacy. They need to do things like scheduling, administrative work, think about payments and reimbursements. Then we have the actual one-to-one doctor-patient relationship. So we need to be concerned about those kinds of appointments. We need to be concerned about the doctor-patient confidentiality, things like managing prescriptions, perhaps, patient data. So we have to find also a balance that is between automation and the human connection as well. So that's also where the Kaleyra Video real-time platform comes into this omni-channel journey, always putting the patient at the center of that journey. And it's important to know the difference between omni-channel and multi-channel. Say multi-channel is the approach where we talk about one specific product, service, concept through one specific channel. In omni-channel, we put that patient at the center of all of our communication, and all of that is built around the patient and their specific needs. So what exactly is Kaleyra Video WebRTC? So it's our real-time connection platform. It's based on WebRTC technology that allows you to automatically connect from your existing touch points. So through our REST APIs and SDKs, the end user can connect directly from whatever touch point they're already in. Since it relies on WebRTC technology, it's an internet connection, so there's no need for third-party software installations or any kind of infrastructure. It's a full white label solution, so you don't see Kaleyra underneath the service, so you can customize this to your organization's branding, or however you want the end user to see the platform. So it's allowing organizations today to offer this real-time, fully branded platform that really enhances the omni-channel experience and engagement. So when we look at what are some of the advantages of this platform, we like to call it a patient journey enhancer, okay? Because it puts the patient at the center of the communication, and it enhances that full communication journey. Our tool is the most customizable audio and video WebRTC calling product on the market that also guarantees high quality and secure calls. So when a lot of times we think about web video conferencing tools today, we think about our classic video conferencing tools. But this today is, this is a one-to-one, and it's more of a customized approach to it. So it's real-time engagement, enhanced security through our protocols, seamless integration, which is very important because this integrates with other tools, customizable solution, and efficient management. How can you connect? So you can either do it through a link generator, you can do it through a widget, web SDK, click-to-call API, mobile SDKs, or we also have the connection with Glass SDKs, so any Android operated device with for example, Google Glasses, but I think we should focus on the other connections that we have here. What are some of the features of our platform? As I already mentioned, the custom branding, but I think it's really what you can do in call as well. So there's a lot of collaborative tools, whiteboard, which a lot of platforms do not have. So this is a way that you can interact directly within the platform, screen share, in-call snapshots, file shares, So it's really not just a connecting platform, it's an interactive and collaborative platform as well. And there's also analytics and reporting. So as I mentioned, there's co-browsing for real-time collaboration. If you need to share also in-app or via browser, you don't lose sight of who you're speaking with, and you can also collaborate on what you're working with. And again, it's all customized. Why do we like to call this the patient journey enhancer? So it's not just a communication channel. It's really a solution that we build from UX and UI design. And I know that this is typically how we associate with business and consumers, but it's really building a patient experience together with the customer and how they want to integrate. So once the real-time call is requested, and that can be done either requesting a callback, requesting a scheduled call, or with click to call, it can be done live, just waiting for the next operator to connect. And this can also be with back office management. We can integrate with other tools, booking tools, CRM platforms, and other administrative tools so that everything can be recorded, archived, and also have full control over that scheduling system. I just wanted to also mention that we do have digital signature. So we do have the ability to formally sign contracts or documents within the platform. So that's something that you can do if you need to sign any kind of documents while you're on a call with healthcare providers.
Just a reminder, 2 minutes ending for
I have a couple more points and then I'll wrap it up. So I know a lot of times when we think about omnichannel journey, we also think about the costs associated with it. So the solutions that we've been implementing, it's how does WebRTC also help our bottom line? We see a lot of requests, whether it's through commerce, whether it's through retail, whether it's through healthcare, is we want to reduce the number of operators we have on field or on site, and we want to do more digitally. This helps you do this more efficiently and reduce that kind of on-site personnel. It reduces on-site visit and support time. Like we said, home healthcare, digital healthcare reduces our costs. It streamlines customer service processes, easily scalable, and it's an addition to your service offering. I just wanted to give you the last overview of how we kind of connect these things as well. So think about if you're using WhatsApp as a platform to communicate with your patient or with your end user, you can send them, you can have a conversation, you can link them directly to a video call that they can join automatically from that touch point. Then you can send them, for example, a transactional email with attachments, documents of their call. You can send them a link of a reminder of their next appointment. And this keeps them all in your digital ecosystem loop as well. Just this is my last point that I wanted to share with you. We're all about helping our customers with the right message, the right channel, and the right time, and helping you find that balance between automation and human connection. So the idea is let's automate when we have to and connect when we can, because customers and end users and patients still want that real-time connection. How do you get started? If you want to know more about Kaleyra Video, you can request, some information from me, from Kaleyra. We're happy to walk through the use case with you, demo the product for you, and get you started with a sandbox environment. Thank you.
Thank you, Mary. Thank you for your intervention. It was really interesting looking all the different tools and ways that use Kaleyra to interact with the clients and to improve the communication around patients and the institutions. Now I would like to leave the stage to Riccardo, our beloved guest, that he will speak about MDConcierge business model and what kind of technology MDConcierge rely to provide their digital services.
Thank you, Andrea. Thank you to all the guests here today. I'll just do a short speech about MiaCare, about MDConcierge and the collaboration between MiaCare and MDConcierge in the last 3 years. So, first of all, a few information about MDConcierge. MDConcierge is a private healthcare company based in Milan and in Italy. And we have 3 main topics of offering to our customers. The first one is to provide personalized prevention plans. We provide health welfare campaigns for companies, for also big companies. There are some big companies here in Milan, and we provide some welfare healthcare services for them. And also we make visits and diagnostics service. In the last years, the network of clinicians that work with us is over 100 doctors or health professionals, 15,000 patients, and we are open until 2018, so it's 5 years now. The needs of MDConcierge are here represented. First of all, we were searching for a platform that was scalable, integrable, and then can adopt all the kind of technology that in the actual healthcare ecosystem is required. So that was our first need. Also, we want to provide a unified system for patients to manage all the stuff regarding the healthcare area. So not just the documentation or not just the management of their visit or the telemedicine, but a system that can integrate all of these aspects of the healthcare life of each patient. And also we wanted to have a good level of customization and autonomy, so we can quick respond to the customers or to the doctor's need, like if we have to create a customized template for a specific customer or for a specific diagnostic service. And also, last but not least, the topic of the security, the cybersecurity, not just the cybersecurity like data security, but also to be sure that the partner we work with, it's an adequate partner for all of the requirements for the GDPR, for the healthcare requirements. So that was at the starting point what we were looking for. And the solution we found with MiaCare is to have a platform, an healthcare platform that can respond to all of our needs, can also integrate with third-party providers, and also have an API console, so we can integrate not only with the partner of MiaCare like Kaleyra, but also if we have other vendors outside of the MiaCare network, with the API console, we can integrate multiple software with our solution and other solutions. Also with Kaleyra, we started to have a telemedicine system integrated with our MiaCare in MDConcierge experience. So with just one login, as I said before, you find your clinical documentation, you find your appointments, and you can start a visit, an online visit with a doctor, and you can share with the doctor in a secure way documents, pictures, information, and as I said, we can create and customize reports, templates, interfaces in just a few minutes. So we have an important point of work that we can customize by ourselves. And with the mobile app, the patient have the sensation that he can look at his healthcare history within his mobile app at his own end. Obviously, because of work, it's a continuous work in progress. We have some challenges open, And the main challenges that now we are facing is to continuously improve the experience for doctors and for patients, because every time we insert into our experience a new function, a new development, a new product, the complexity can increase. So we have to always build a better experience. Also, we are trying to structurizing the MDConcierge team because the platform of MiaCare have a lot of tools, a lot of ways to improve it and to use it with some low code, no code tools, and with other tools that maybe required some coding experience. So we are structuring our teams to reach the highest benefit for this platform. And finally, we are trying to optimizing the dialogue between doctors and patients with obviously the telemedicine system, but also with other tools of communication. And finally, the goals that we already have reached is that our patients are satisfied, but this kind of experience with all of their history in just one single point. The flexibility that we have with this platform can help us cover a lot of businesses and services, welfare, appointments, prevention, as I said before. And at last, with this platform that reach all of the requirements, what we also have reached is the acquisition of some big clients, multinational clients for MDConcierge. So, Andrea, I finished my slides, so I pass the word to you.
Great, Riccardo. Thank you very much for your witness. It was really interesting to know more about MDConcierge and how you address health issues to patients, and how you can actually improve the quality of life of those assisted people through digital services, including as well video streaming services related to telemonitoring and televisiting. We just have a couple of minutes. I see that there are a few questions from the chat. I would like to give you a quick question to Marzio. Someone from the chat asked that if you ever experienced integration issues with Kaleyra, and I would add, like, in general, how integration works with MiaCare, which is an open platform, compared to the partner network that MiaCare can handle.
So no, we haven't got any issue with the integration. So the integration was not just connecting through APIs, right? So their backend services to the microservice that we built, but was also making sure that every single aspect around security and data privacy was aligned compared to the level of quality we want to deliver to our end customers. So that was a smooth integration in terms of requirements and documentation. So everything today it's well defined in our documentation. So if you go through our website and you search for the Kaleyra plugin, you find essentially our documentation and of course a link to public documents of Kaleyra as well. So that is also a way to get I would say the initial information around services, performance, GDPR compliance, SLA levels, right? So everything that at the end you will need to make up and running a service for essentially delivering healthcare.
Okay, Marzio, thank you very much for your answer. So we are running out of time. We are perfectly on time.